Welcome back, future nurses. Today, we're on day 26 of our 30-day NCLEX practice test challenge. And this one is packed with high-yield exam-style questions designed to push your critical thinking, sharpen your clinical judgment, and get you test day ready. But before we dive in, here's something you can't miss. We are currently running a massive 70% off on our online NCLEX crash course. You'll get live and recorded classes, PDF notes, over 5,000 previously asked NCLEX questions, NGN discussions with in-depth lectures, a complete study planner, and so much more. More than 10,000 students have already passed their NCLEX with this exact course. Now it's your turn to become the next success story and pass in one attempt. The link to enroll is right in the description box. Don't wait, this offer is for a very limited time. Let's jump right into question 1. Where identifying the type of shock quickly can truly make the difference between life and death. Question 1. In this case, a nurse is assessing a patient who may be experiencing neurogenic shock. The question asks which assessment finding is most consistent with this diagnosis, with the available options being A. Respiratory acidosis, B. Weak, thready peripheral pulses, C. Profuse sweating, and D. Excessive urine output. The correct answer is option B. Weak, thready peripheral pulses. This is because such pulses are a hallmark feature of neurogenic shock, which is a form of distributive shock caused by the loss of sympathetic tone, often following a spinal cord injury. This loss of vascular tone results in widespread vasodilation, leading to hypotension, bradycardia, hypothermia due to heat loss, tachypnea, and decreased urinary output. As blood pools in the peripheral vessels, the pulse becomes faint and difficult to palpate, making this the most consistent clinical finding in such a scenario. Question 2. Imagine a patient recovering from a transurethral resection of the prostate, commonly known as TURP, who is receiving continuous bladder irrigation to keep the urinary tract clear and prevent clot retention. During assessment, the nurse notices that the urinary catheter output has completely stopped. The question asks what should be the nurse's first action, with the options being A. Reinsert a new catheter, B. Increase the rate of bladder irrigation, C. Gently attempt to clear the obstruction, and D. Notify the healthcare provider. The correct answer is option C. Gently attempt to clear the obstruction. This is because after TURP, catheter blockage is often caused by clot formation at the catheter tip. The priority is to first check the tubing for kinks, and then gently irrigate the catheter to dislodge any clot. Question 3. Let us now turn to a case involving visual field loss, where safety and adaptation strategies are key to maintaining independence. A client has been diagnosed with homonymous hemianopia, and the nurse must decide which nursing intervention is most appropriate to include in the care plan. The options are A. Apply an eye patch to the affected eye, B. Teach the client to move their head from side to side when scanning, C. Speak more slowly, clearly, and in a deeper tone, and D. Provide earplugs to reduce environmental noise. The correct answer is option B. Teach the client to move their head from side to side when scanning. This is correct because homonymous hemianopia involves loss of vision in the same half of the visual field in both eyes. Encouraging the client to actively scan by turning the head expands the visual field, improves spatial awareness, and reduces safety risks, such as bumping into obstacles. Eye patches, as in option A, are used for double vision rather than visual field deficits. Adjusting speech patterns, as in option C, addresses hearing problems, not vision loss. Earplugs, as in option D, reduce environmental noise but do not address the visual impairment. Question 4. Moving on to psychiatric pharmacology, a client has been prescribed a monoamine oxidase inhibitor, as the MAOI, and the nurse needs to identify the primary condition for which this medication is used. The options include A. Personality disorders, B. Major depressive disorder, C. Schizophrenia, and D. Bipolar disorder. The correct answer is option B. Major depressive disorder. This is correct because MAOIs are typically reserved for severe depression that has not responded to first-line treatments, such as selective serotonin reuptake inhibitors. They work by inhibiting the enzyme monoamine oxidase, thereby preventing the breakdown of neurotransmitters like serotonin, norepinephrine, and dopamine, which enhances mood regulation. Option A is incorrect, because personality disorders are primarily managed through psychotherapy rather than MAOIs. Option C is incorrect since schizophrenia is treated with antipsychotic medications, And option D is incorrect, as bipolar disorder is best managed with mood stabilizers, and antidepressants may trigger manic episodes. Question 5. Let us consider an acute psychiatric emergency. A client with bipolar 1 disorder is experiencing acute mania, and the nurse must anticipate which medication is most likely to be prescribed. The options are A. Valproic acid, B. mirtazapine, C. bupropion, and D. fluoxetine. The correct answer is option A. Valproic acid. This is correct because valproic acid is an effective mood stabilizer used in controlling acute manic episodes. It can be administered orally or intravenously, making it suitable for both inpatient stabilization and ongoing outpatient management. Liver function must be closely monitored due to the risk of hepatotoxicity, and therapeutic blood levels should be maintained for effectiveness. Option B, mirtazapine, and option C, bupropion, are antidepressants, which could exacerbate mania in bipolar patients. Option D, fluoxetine, is a selective serotonin reuptake inhibitor and carries a similar risk of triggering manic episodes. Question 6. Let us move on to a scenario involving medication administration routes, where accuracy in technique ensures proper absorption. The healthcare provider orders a medication to be given via the buccal route, and the nurse must determine the correct method. The options are A. Into the client's ear, pulling the pinna down and back, B. Under the client's tongue, C. Between the cheek and gum, and D. Into the nasal passage. The correct answer is option C. Between the cheek and gum. This is correct because buccal medications are placed between the cheek and gum, where they dissolve and are absorbed directly into the bloodstream, bypassing the gastrointestinal tract and avoiding first-pass metabolism. Option A is incorrect because ear administration is otic or auricular, not buccal. Option B describes the sublingual route, which is also a rapid absorption method but different from buccal administration. Option D refers to the intranasal route, used for medications such as desmopressin or fentanyl. Question 7. Next, consider a nurse triaging patient phone calls, where recognizing urgent symptoms is critical. The nurse must decide which caller should receive the most urgent follow-up. The options are A. Reports nausea and vomiting 1 day after cataract surgery. B. Reports painful urination 2 days after laparoscopic hysterectomy. C. Reports stoma swelling 3 days after ileostomy placement. And D. Refuses physical therapy 4 days after total hip replacement due to pain. The correct answer is option A. Reports nausea and vomiting 1 day after cataract surgery. This is correct because persistent nausea and vomiting after eye surgery can signal increased intraocular pressure, which may result from complications such as hemorrhage or acute glaucoma. Elevated intraocular pressure can damage the optic nerve and cause irreversible vision loss, making prompt evaluation essential. Option B may indicate a urinary tract infection, but is not immediately life-threatening. Option C involves mild stoma swelling, which is normal in the early post-operative period, unless accompanied by dusky color, lack of output, or severe pain. Option D affects rehabilitation progress, but does not represent an urgent medical emergency. Before we jump to the next question, listen carefully, because this could be the turning point in your NCLEX journey. We are giving a massive 70% off on our online NCLEX crash course, but only for a very limited time. This isn't just another course. This is the exact program that has helped over 10,000 nursing students pass their NCLEX on the very first attempt. Inside, you're getting live interactive classes, lifetime access to recorded sessions, crystal clear PDF notes, over 5,000 real exam-style questions, NGN case discussions with in-depth lectures, and a complete day-by-day study planner. Everything you need to walk into the exam with total confidence. Think about it. One decision today could be the difference between months of stress and finally wearing that RN or PN badge with pride. Don't wait for another exam cycle. Don't let this chance slip away. Click the enrollment link in the description right now. Grab your 70% discount and let's make sure you pass NCLEX in one attempt, just like thousands before you. Question 8. Now let us move to a teaching scenario about colostomy care, where correct patient education prevents complications. The nurse must identify which patient statement signals the need for correction. The options are A. I will call my doctor if my stoma turns bluish. B. I will slowly reintroduce high-fiber foods. C. I must wear a pouch over my stoma at all times. And D. I will clean the skin around my stoma with rubbing alcohol. The correct answer is option D. I will clean the skin around my stoma with rubbing alcohol. This is correct because rubbing alcohol can damage the peristomal skin and decrease wafer adhesion, leading to leaks and irritation. Instead, mild, non-moisturizing soap and water should be used for cleaning. Option A is correct practice, as a bluish stoma may indicate necrosis and requires immediate medical attention. Option B is also correct, as high-fiber foods should be reintroduced gradually to reduce gas and cramping. Option C is appropriate since wearing a pouch helps collect stool and protect the skin. Question 9. Shifting to a prenatal setting, a pregnant client in the first trimester notices a dark vertical line running down her abdomen, and the nurse must document the finding. The options are A. Melasma, B. Linea nigra, C. Varicose veins, and D. Striae gravidarum. The correct answer is option B. Linea nigra. This is correct because hormonal changes during pregnancy can cause the light-colored linea alba to darken into the linea nigra, which extends from the pubis to the fundus and typically fades after childbirth. Option A, melasma, refers to dark patches on the face, often triggered by hormones and sun exposure. Option C, varicose veins, are swollen, distended veins from increased blood volume and pressure, not abdominal lines. Option D, striae gravidarum, are stretch marks caused by connective tissue stretching. Question 10. In a pre-procedural care scenario, a client is experiencing severe anxiety before undergoing an endoscopy, and the nurse must anticipate the most likely prescribed medication. The options are A. Oxycodone, B. Midazolam, C. Citalopram, and D. Haloperidol. The correct answer is option B. Midazolam. This is correct because midazolam is a short-acting benzodiazepine with a rapid onset of 2 to 5 minutes when given intravenously. It effectively reduces anxiety, induces sedation, and provides amnesia for the procedure. An antidote, flumazenil, should be readily available in case of severe respiratory depression. Option A, oxycodone, is an opioid analgesic for pain control, not anxiety. Option C, citalopram, is an antidepressant requiring weeks to achieve effect. Option D, haloperidol, is an antipsychotic used for psychosis and agitation, not pre-procedure sedation. Question 11. Let us look at a genetic counseling situation. Expectant parents are seeking guidance, and the father has sickle cell anemia, while the mother is a carrier of the sickle cell trait. The question asks about the probability that their child will have sickle cell anemia. The options are A, 25%, B, 50%, C, 75%, and D, 100%. The correct answer is option B, 50%. This is correct because sickle cell anemia is an autosomal recessive disorder. The father's genotype is SS, disease, and the mother's genotype is SS, carrier. A Punnett square shows a 50% probability the child will inherit 2 sickle cell genes, SS, and have the disease, and a 50% probability of inheriting 1 sickle cell gene and 1 normal gene, SS, becoming a carrier without disease symptoms. There is no chance of having a completely unaffected genotype SS in this pairing. Question 12. Let us now focus on a teaching moment about oral contraceptives, where clarity is key to ensuring correct patient understanding. The nurse asks the client to repeat what they know about how the medication works, and one statement stands out as requiring correction. The options are A. Combination pills contain estrogen and progesterone to stop ovulation. B. These pills may increase my risk for blood clots and high blood pressure. C. If I take them consistently, they are very effective at preventing pregnancy. And D. They stop sperm from entering the cervical opening. The correct answer is option D. They stop sperm from entering the cervical opening. This is because oral contraceptives do not physically block sperm from the cervical OS. Instead, they prevent ovulation, thicken cervical mucus to make sperm passage more difficult, and alter the uterine lining to reduce implantation chances. Preventing sperm entry is the primary mechanism of barrier methods such as condoms or diaphragms. Option A is correct as combination pills suppress the hormonal signals required for ovulation. Option B is correct because these pills do increase the risk of thrombophlebitis and hypertension due to elevated clotting factors. Option C is also correct, since when taken consistently at the same time each day, they are up to 99.7% effective at preventing pregnancy. Question 13. In our next scenario, a pregnant client in her first trimester is diagnosed with hyperthyroidism, and the nurse must anticipate the medication most likely to be prescribed. The options are A. Levothyroxine, B. Calcitriol, C. Methimazole, and D. Propylthiouracil, PTU. The correct answer is option D, propylthiouracil, PTU. This is correct because PTU is preferred in the first trimester due to its lower teratogenic risk compared to methimazole. In the second and third trimesters, methimazole becomes the preferred drug to avoid the risk of PTU-induced hepatotoxicity with prolonged use. Option A, levothyroxine, is used for hypothyroidism and would worsen hyperthyroid symptoms. Option B, calcitriol, is a vitamin D analog and unrelated to thyroid disorders. Option C, methimazole, is avoided in early pregnancy due to a higher risk of congenital malformations but can be used later on. Question 14. Let us move our attention to a clinical skills observation, where a newly hired nurse is administering an intramuscular injection to an adult. The nurse's action that would require intervention must be identified. The options are A. Plans to inject in the dorsogluteal site, B. Positions the needle for a 90-degree insertion, C. Cleans the site with isopropyl alcohol before injecting, and D. Performs hand hygiene before and after the procedure. The correct answer is option A, plans to inject in the dorsogluteal site. This is because the dorsogluteal site is no longer recommended due to the risk of injury to the sciatic nerve and nearby blood vessels. Safer alternatives for adults include the ventrogluteal, vastus lateralis, and deltoid sites. Option B is correct practice as intramuscular injections are given at a 90-degree angle for optimal muscle penetration. Option C is correct as cleaning with isopropyl alcohol before injection is part of proper aseptic technique. Option D is also correct since hand hygiene before and after the procedure is essential for infection prevention. Question 15. Now we consider a medication safety scenario involving enoxaparin. The nurse must identify which laboratory tests should be prioritized for monitoring. The options are A. Platelet count, B. Activated partial thromboplastin time, APTT, C. International Normalized Ratio, INR, and D. Troponin. The correct answer is option A, platelet count. This is correct because enoxaparin, a low molecular weight heparin, carries the risk of heparin-induced thrombocytopenia, HIT, which involves a dangerous drop in platelets and increased clot risk. Monitoring platelet count allows for early detection of this complication. Option B is incorrect because APTT is used to monitor unfractionated heparin, not LMWH. Option C is incorrect as INR is used for warfarin monitoring, and option D is unrelated, being a cardiac injury marker. Before we move to the next question, I need to talk to you. Yes, you watching right now. I know how much this exam means to you. I know the sleepless nights, the stress, the moments you've doubted yourself. But I also know this. You do not have to go through this alone. Right now, we're offering a massive 70% off on our online NCLEX crash course, the exact program that has helped over 10,000 students pass their NCLEX on the very first attempt. Inside, you'll get live classes where your doubts are solved instantly, recorded sessions you can watch anytime, detailed PDF notes, over 5,000 real nclex-style questions, NGN case discussions, and a proven study plan that tells you exactly what to do every single day. I want you to imagine something. The day you see that passing score, the moment you put on that RN or PN badge, the proud smile on your face, and on the faces of your family. That moment is closer than you think, but only if you take the right step right now. This is your chance. Don't let fear, hesitation, or procrastination steal your dream. Click the enrollment link in the description, grab your 70% discount, and let's make sure you pass NCLEX in one attempt. Together. Question 16. In an ethical decision-making case, a nurse witnesses a colleague starting a shift under the influence of alcohol but chooses not to report it. The question is, which ethical principle is being violated? The options are A. Confidentiality, B. Non-maleficence, C. Justice, and D. Beneficence. The correct answer is option B, non-maleficence. This is because non-maleficence means do no harm, and failing to report an impaired colleague allows potential harm to patients by enabling unsafe care. Option A is incorrect because confidentiality applies to patient information, not concealing unsafe professional behavior. Option C, justice, is about fairness in care delivery. And option D, beneficence, is about promoting good. Both relevant to ethics but not the primary breach here. Question 17. Shifting to a neurological assessment scenario. The nurse must identify which finding supports a diagnosis of Parkinson's disease. The options are A. Nystagmus, B. Swollen, red joints, C. Orthostatic hypotension, and D. Spontaneous bruising. The correct answer is option C. Orthostatic hypotension. This is correct because Parkinson's disease often involves autonomic nervous system dysfunction, leading to non-motor symptoms such as orthostatic hypotension from impaired blood pressure regulation. Option A is incorrect, as nystagmus is linked to cerebellar or vestibular disorders. Option B is associated with inflammatory arthritis. And option D, while possible due to medication side effects, is not a primary diagnostic sign. Question 18. In a respiratory assessment case, a client with chronic obstructive pulmonary disease reports difficulty sleeping at night, and the nurse must ask the question most likely to reveal the cause. The options are A. Can you tell me what you usually eat right before bedtime? B. When you sleep, how many pillows do you normally rest your head on? C. Would you say you have always been a light sleeper? And D. Does your partner's snoring disturb your sleep? The correct answer is option B. When you sleep, how many pillows do you normally rest your head on? This is correct because it helps assess for orthopnea, difficulty breathing when lying flat, which is common in COPD. Patients often need multiple pillows or head elevation for comfort. Option A addresses diet, which may influence sleep but is secondary in this case. Option C provides background information but does not assess breathing difficulty. And option D considers environmental noise, which is less relevant for COPD-related sleep issues. Question 19. Now to an emergency toxicology scenario. A client arrives in the emergency department after intentionally ingesting nortriptyline. The nurse must identify the most critical information to obtain immediately. The options are A. The exact number of tablets ingested, B. The condition for which the medication was prescribed, C. Any history of prior suicide attempts, and D. Events immediately before the overdose. The correct answer is option A. The exact number of tablets ingested. This is correct because nortriptyline, a tricyclic antidepressant, carries a high risk of fatal arrhythmias and overdose, and knowing the pill count allows estimation of the toxic load and guides urgent interventions such as ECG monitoring and antidote preparation. Option B provides background but does not alter immediate management. Option C is important for long-term care planning, and option D gives context but is not the first priority when the patient's condition can rapidly deteriorate. Question 20. In a physical assessment scenario, the nurse percusses over most areas of a healthy abdomen and must know the expected sound. The options are A. Hyperresonance, B. Tympany, C. Resonance, and D. Dullness. The correct answer is option B. Tympany. This is correct because tympany, a high-pitched drum-like sound, is the normal percussion finding over air-filled organs such as the intestines, which make up much of the abdominal cavity. Option A, hyperresonance, is typically heard over hyperinflated lungs. Option C, resonance, is the normal sound over healthy lung tissue. Option D, dullness, is expected over dense organs such as the liver or spleen. Question 21. In the labor and delivery setting, continuous fetal monitoring is essential for detecting early signs of distress. While monitoring a client in active labor, the nurse observes variable decelerations on the fetal heart rate tracing and must determine the most likely cause. The options are A. Increased fetal movement, B. Pressure on the fetal head during contractions, C. Maternal vena cava compression, and D. Umbilical cord prolapse. The correct answer is option D. Umbilical cord prolapse. This is correct because a prolapsed cord can intermittently obstruct blood flow to the fetus, leading to variable or prolonged decelerations and even bradycardia, all of which signal possible hypoxia. This condition is an obstetric emergency requiring immediate action to relieve cord pressure and prepare for urgent delivery if unresolved. Option A is incorrect since fetal movement usually causes accelerations rather than decelerations. Option B is associated with early decelerations from head compression, which are typically benign. Option C results in late decelerations from reduced placental perfusion, not variable patterns. Question 22. In a postpartum assessment 2 weeks after delivery, a client reports fever, headache, and tenderness in the left breast, and the nurse notes enlarged lymph nodes in the left axilla. The question is, which condition is most consistent with these findings? The options are A. Endometritis, B. Mastitis, C. Pelvic inflammatory disease, and D. Cystitis. The correct answer is option B. Mastitis. This is correct because mastitis often develops between 2 to 4 weeks postpartum, presenting with localized breast pain, swelling, redness, and flu-like symptoms, sometimes with axillary lymphadenopathy on the affected side. Option A. Endometritis involves uterine lining inflammation with pelvic pain and fever, not localized breast findings. Option C, PID, causes pelvic pain and reproductive tract inflammation, but does not involve the breasts. Option D, cystitis, is a bladder infection with urinary symptoms, not breast changes. Question 23. In an endocrine emergency scenario, a client receiving an intravenous infusion of regular insulin for diabetic ketoacidosis has a potassium level of 2.9 milliequivalent per liter. The nurse must determine the first action. The options are A. Call the primary healthcare provider. B. Stop the insulin infusion immediately. C. Obtain a 12-lead ECG. And D. Check the client's urine output. The correct answer is option B. Stop the insulin infusion immediately. This is correct because insulin drives potassium into cells, which would worsen the already critical hypokalemia and could cause life-threatening arrhythmias or respiratory muscle weakness. Halting the infusion prevents further potassium shift until levels are corrected. Option A follows after stopping the infusion, not before. Option C is useful for monitoring cardiac effects but does not prevent worsening. Option D is routine but not the urgent priority here. Question 24. In a prioritization scenario, a nurse preceptor is observing a new nurse's sequence of tasks on a medical surgical unit. The question asks which action, if done first, would reflect correct prioritization. The options are A. Arranging a home health referral, B. Changing a central venous catheter dressing, C. Collecting a urine specimen from a catheterized patient, and D. Checking capillary blood glucose for a patient on continuous IV regular insulin. The correct answer is option D. Checking the capillary blood glucose of a patient on a continuous intravenous infusion of regular insulin. This is correct because continuous IV regular insulin peaks quickly and the patient is at high risk for hypoglycemia, which can cause seizures, coma, or death if not promptly identified. Option A is important for discharge planning but not urgent. Option B prevents infection but is lower priority than preventing acute hypoglycemia. Option C is also a lower priority in this context. Question 25. In a visual recognition question, the nurse is reviewing images of craniofacial abnormalities and must identify which image depicts a cleft palate. The options are A. Image A, B. Image B, C. Image C, and D. Image D. The correct answer is option B. Image B. This is correct because a cleft palate is a congenital opening in the roof of the mouth caused by incomplete fusion during fetal development. Option A shows a cleft lip, an opening in the upper lip. Option C depicts choanal atresia, a blockage of the nasal passage. Option D shows micrognathia, an abnormally small lower jaw. Before we move to the next question, I need to talk to you. Yes, you watching right now. I know how much this exam means to you. I know the sleepless nights, the stress, the moments you've doubted yourself. But I also know this. You do not have to go through this alone. Right now, we're offering a massive 70% off on our online NCLEX crash course, the exact program that has helped over 10,000 students pass their NCLEX on the very first attempt. Inside, you'll get live classes where your doubts are solved instantly, recorded sessions you can watch anytime, detailed PDF notes, over 5,000 real NCLEX-style questions, NGN case discussions, and a proven study plan that tells you exactly what to do every single day. I want you to imagine something. The day you see that passing score, the moment you put on that RN or PN badge, the proud smile on your face, and on the faces of your family, that moment is closer than you think, but only if you take the right step right now. This is your chance. Don't let fear, hesitation, or procrastination steal your dream. Click the enrollment link in the description, grab your 70% discount, and let's make sure you pass NCLEX in one attempt together. Question 26. In a consent understanding scenario, the nurse approaches a client with a blood pressure cuff. and the client silently extends their arm. The question is which type of consent is demonstrated. The options are A. Informed consent, B. Implied consent, C. Express consent, and D. Written consent. The correct answer is option B. Implied consent. This is correct because implied consent is granted through actions or behavior rather than verbal or written agreement. Extending the arm signals agreement to have blood pressure measured. Option A is incorrect because informed consent is for invasive or high-risk procedures after explaining risks and benefits. Option C is incorrect as express consent is verbal or written. Option D is incorrect as written consent is formal documentation required for high-risk interventions. Question 27. In a cognitive impairment care scenario, a client with confusion has difficulty recalling recent events and becomes disoriented in new settings. The nurse must choose the best statement to help orient the client. The options are A. Good morning. Do you know where you are right now? B. Hello, I'm Susan Jones, your nurse for today. C. How are you? Remember, you're in the hospital. And D. Good morning. You're in the hospital, and I'm your nurse, Susan Jones. The correct answer is option D. Good morning. You're in the hospital, and I'm your nurse, Susan Jones. This is correct because it provides clear, factual orientation without requiring the client to recall information they may not remember, reducing frustration. Option A risks causing stress if they cannot answer. Option B only identifies the nurse, not the setting. Option C implies they should remember, which can be frustrating. Question 28. In an ethical and communication scenario, a patient requests a room change after overhearing that their roommate has HIV. The nurse must determine the most appropriate action. The options are A. Move the patient to a private room. B. Ask the patient to explain their concerns in more detail. C. Inform the risk management department. And D. Place an extra divider between beds. The correct answer is option B. Ask the patient to explain their concerns in more detail. This is correct because it uses therapeutic communication to explore the patient's feelings and allows the nurse to provide accurate education about HIV transmission. Option A could reinforce misconceptions. Option C is unnecessary without an incident or policy violation. Option D addresses privacy, but not the underlying fear or misinformation. Question 29. In an intravenous antifungal therapy scenario, the nurse must decide which laboratory value requires the closest monitoring during amphotericin B treatment. The options are A. Triglyceride levels, B. Hemoglobin, A1C, potassium levels, and D. High-density lipoprotein levels. The correct answer is option C, potassium levels. This is correct because amphotericin B frequently causes electrolyte disturbances, particularly hypokalemia, due to its effects on cell membrane permeability and potassium shifting into cells. Monitoring potassium closely helps prevent life-threatening complications such as arrhythmias. Option A is incorrect since triglycerides are not routinely affected. Option B is unrelated to amphotericin B and is used for long-term glucose control in diabetes. Option D is incorrect because HDL is not significantly impacted by this medication. Question 30. In a trauma care setting, the nurse suspects a pneumothorax after a blunt chest injury and must choose the most supportive finding. The options are A. Diminished breath sounds on one side, B. Barrel-shaped chest, C. Abnormally slow breathing, and D. Pulse deficit. The correct answer is option A. Diminished breath sounds on one side. This is correct because air in the pleural space collapses part of the lung, reducing or eliminating breath sounds in the affected area. Option B describes chronic lung conditions like COPD. Option C is incorrect since pneumothorax usually causes tachypnea, not bradypnea. Option D is associated with arrhythmias, not pneumothorax. Question 31. When evaluating Parkinson's disease therapy, the nurse must recognize which finding shows that carbidopa-levodopa is effective. The options are A. Tremors have lessened, B. Drooling has decreased, C. Seizure activity has reduced, and D. Muscle spasticity has improved. The correct answer is option A. Tremors have lessened. This is correct because carbidopa or levodopa is the mainstay therapy for Parkinson's disease and improves motor symptoms such as resting tremor, rigidity, and bradykinesia. Option B is incorrect because drooling may persist and is treated with other agents. So option C is unrelated since seizures are not a Parkinson's feature. Option D is incorrect because Parkinson's causes stiffness, not spasticity. Question 32. In addiction treatment follow-up, a client taking a camprosate for alcohol use disorder reports progress, and the nurse must determine the best sign of therapeutic effect. The options are A. The voices I used to hear are gone. B. I feel more motivated during the day. C. I've completely stopped drinking alcohol. And D. I feel less anxious in social situations. The correct answer is option C. I have completely stopped drinking alcohol. This is correct because acamprosate is designed to help maintain abstinence after alcohol cessation by modulating GABA and glutamate activity to reduce cravings. Options A, B, and D describe potential benefits in other conditions but are not the primary treatment goal of acamprosate. Question 33. In a medication review, the nurse must clarify which prescription with the provider. The options are A. Captopril for CHF, B. Metoprolol for PVCs, C. Verapamil for atrial fibrillation, and D. Spironolactone for ESRD. The correct answer is option D. Spironolactone for a patient with end-stage renal disease. This is correct because spironolactone is potassium-sparing, and ESRD patients already have limited renal potassium excretion, increasing the risk for hyperkalemia and fatal arrhythmias. Option A is appropriate for CHF, option B may be used to control PVCs, and option C is effective for atrial fibrillation rate control. Question 34. In a newborn care scenario, the nurse must identify the cause of erythroblastosis fetalis. The options are A. Overproduction of red blood cells, B. Blood type incompatibility between mother and infant, C. Excessive proliferation of white blood cells, and D. Sickling of red blood cells. The correct answer is option B. Blood type incompatibility between mother and infant. This is correct because maternal antibodies cross the placenta and destroy fetal RBCs in Rh or ABO incompatibility, causing anemia, hydrops, fetalis, and possible heart failure. Option A describes polycythemia vera, option C describes leukocytosis, and option D describes sickle cell anemia. Question 35. In dermatology, the nurse must anticipate which drug for severe acne vulgaris. The options are A. Isotretinoin, B. Acyclovir, C. Ketoconazole, and D. Ethambutol. The correct answer is option A. Isotretinoin. This is correct because isotretinoin is an oral retinoid that shrinks sebaceous glands, reducing oil production in treatment-resistant severe acne. Option B treats herpes, option C treats fungal infections, and option D treats tuberculosis. Before we move to the next question, I need to talk to you. Yes, you watching right now. I know how much this exam means to you. I know the sleepless nights, the stress, the moments you've doubted yourself, but I also know this. You do not have to go through this alone. Right now, we're offering a massive 70% off on our online NCLEX crash course, the exact program that has helped over 10,000 students pass their NCLEX on the very first attempt. Inside, you'll get live classes where your doubts are solved instantly, recorded sessions you can watch anytime, detailed PDF notes, over 5,000 real NCLEX-style questions, NGN case discussions, and a proven study plan that tells you exactly what to do every single day. I want you to imagine something. The day you see that passing score, the moment you put on that RN or PN badge, the proud smile on your face and on the faces of your family. That moment is closer than you think, but only if you take the right step right now. This is your chance. Don't let fear, hesitation, or procrastination steal your dream. Click the enrollment link in the description, grab your 70% discount, and let's make sure you pass NCLEX in one attempt. Together. Question 36. In endocrine therapy monitoring, the nurse must identify the best indicator that vasopressin is working in diabetes insipidus. The options are A. Blood glucose within normal limits, B. Normalized serum sodium, C. Decreased urine volume, and D. Stable heart rate. The correct answer is option C. Decreased urine volume. This is correct because vasopressin increases water reabsorption in the kidneys, reducing the excessive urine output typical of DI. Option A is unrelated. Option B may improve indirectly, but is not the primary indicator. And option D is not the main measure of therapeutic effect. Question 37. In a first aid teaching scenario, the nurse advises camp counselors on snakebite management. The options are A. Apply a tourniquet above the bite site. B. Keep the affected limb elevated. C. Attempt to capture the snake for identification. And D. Do not apply ice to the bite area. The correct answer is option D. Do not apply ice to the bite area. This is correct because ice can worsen tissue damage. Option A risks cutting off circulation. Option B may accelerate venom spread. And option C is unsafe, with photography from a distance being a safer identification method. Question 38. In HIV prevention counseling, the nurse must identify which medication is prescribed for pre-exposure prophylaxis. The options are A. Voriconazole, B. Tenofovir emtricitabine, C. Riloxifene, and D. Lurasidone. The correct answer is option B. Tenofovir emtricitabine. This is correct because this combination antiretroviral is approved for PrEP in high-risk individuals and, when taken consistently, reduces HIV acquisition risk by up to 99%. Option A treats fungal infections, option C treats osteoporosis, and option D treats psychiatric disorders. Question 39. In an antepartum monitoring situation, the nurse reviews a non-stress test. NST, result labeled reactive, and must interpret its meaning. The options are A. Fetal heart rate accelerations are less than 15 beats per minute or shorter than 15 seconds. B. No late decelerations are observed. C. Late decelerations are present in at least half of the contractions. And D. At least 2 fetal heart rate accelerations occur within a 20-minute period. The correct answer is option D. At least 2 fetal heart rate accelerations occur within a 20-minute period. This is correct because a reactive NST is a reassuring sign, defined as 2 or more accelerations of at least 15 beats per minute above baseline, lasting at least 15 seconds within a 20-minute period. Option A describes a non-reactive NST. Option B is a feature of a negative contraction stress test, and option C describes a positive contraction stress test, which is abnormal. Question 40. In discharge teaching for hepatitis, A. The nurse must identify the most important point to emphasize. The options are A. Bathe daily using chlorhexidine. B. Clean household surfaces with warm soapy water. C. Have repeat stool testing to confirm you are no longer contagious. And D. Consult your healthcare provider before taking any medications. The correct answer is option D. Consult your healthcare provider before taking any medications. This is correct because hepatitis A affects the liver, and hepatotoxic drugs could worsen the condition. Option A is unnecessary as hepatitis A spreads via the fecal-oral route, not skin contact. Option B is incorrect since disinfection requires a bleach solution rather than soap and water alone. Option C is incorrect because stool testing is not part of routine follow-up. Blood tests are used for diagnosis and monitoring. Question 41. While assessing for type 2 diabetes mellitus, the nurse must recognize which finding supports the diagnosis. The options are A. Fasting blood glucose of 110 milligrams per deciliter. B. Hemoglobin A1C of 7.5%. C. Elevated serum insulin levels. And D. Presence of urine ketones. The correct answer is option B. Hemoglobin A1C of 7.5%. This is correct because an HbA1c greater than or equal to 6.5% meets the diagnostic criteria for diabetes, reflecting average blood glucose over 2 to 3 months. Option A falls in the prediabetes range, 100 to 125 milligrams per deciliter. Option C may occur with insulin resistance but is not diagnostic. Option D is more common in type 1 diabetes or diabetic ketoacidosis. Question 42. In a heart failure exacerbation, the nurse must recognize which vital sign change suggests a complication. The options are A. Decrease in blood pressure, B. Increase in temperature, C. Decrease in respiratory rate, and D. Increase in blood pressure. The correct answer is option A. Decrease in blood pressure. This is correct because a sudden drop in BP can indicate reduced cardiac output and worsening CHF, requiring immediate intervention. Option B may indicate infection, but is not the primary acute concern. Option C is uncommon, as CHF exacerbations typically cause tachypnea. Option D can worsen CHF long-term, but is not an immediate sign of acute decompensation. Question 43. In a pediatric emergency scenario, a 4-year-old presents with tripod positioning, inspiratory stridor, blue lips, mottled skin, excessive drooling, and a temperature of 39 degrees Celsius, with O2 saturation at 82%. The options are A. Keep the child calm and call for emergency airway equipment. B. Obtain IV access. C. Inspect the throat for a cherry red epiglottis. And D. Apply high-flow oxygen via nasal cannula at 100% FiO2. The correct answer is option A. Keep the child calm and call for emergency airway equipment. This is correct because the presentation suggests epiglottitis, a life-threatening airway emergency. The priority is to prevent airway collapse by keeping the child calm and ensuring immediate access to airway equipment. Option B should wait until the airway is secure. Option C risks triggering complete obstruction. Option D is not effective without a patent airway. Question 44. In room assignment planning, the nurse must choose the safest location for a client with dementia, high fall risk, and a history of elopement. The options are A. Private room at the end of the hallway near elevators. B. Private room close to the nurse's station. C. Semi-private room with another Alzheimer's patient. And D. Semi-private room near the stairwell with a hip surgery patient. The correct answer is option B. Private room close to the nurse's station. This is correct because it allows for frequent monitoring and rapid assistance to prevent falls or wandering. Option A increases elopement risk, option C can increase agitation, and option D poses safety concerns for both patients. Question 45. In SIADH management, the nurse must know which lab value requires the closest monitoring. The options are A. Potassium, B. Sodium, C. Glucose, and D. Magnesium. The correct answer is option B. Sodium. This is correct because SIADH causes water retention, leading to dilutional hyponatremia, which can result in seizures, confusion, and neuromuscular weakness if severe. Option A is unaffected unless diuretics or AC inhibitors are used. Option C is only relevant with coexisting diabetes. Option D is unaffected unless diuretics are involved. Question 46. In a rapid sequence intubation scenario, the provider prescribes succinylcholine. The options are A. Provide sedation, B. Reduce airway secretions, C. Prevent bradycardia, and D. Cause temporary skeletal muscle paralysis. The correct answer is option D. Cause temporary skeletal muscle paralysis. This is correct because succinylcholine is a depolarizing neuromuscular blocker used to produce rapid short-term paralysis for intubation. Option A is incorrect as sedatives like propofol are needed separately. Option B and C describe the effects of atropine, not succinylcholine. Question 47. In congenital heart disease, the nurse must know which genetic disorder is commonly associated with atrioventricular AV canal defects. The options are A. Trisomy 18, B. Turner syndrome, C. Trisomy 21, and D. DeGeorge syndrome. The correct answer is option C. Trisomy 21. This is correct because Down syndrome is strongly linked to AV canal defects, as well as atrial and ventricular septal defects. Option A is more often linked to VSD or hypoplastic left heart syndrome, option B to coarctation of the aorta, and option D to interrupted aortic arc or conotruncal defects. Question 48. When evaluating guaifenesin therapy, the nurse must identify the intended effect. The options are A. Decreased productive cough, B. Increased mucus production, C. Reduced mucus viscosity, and D. Less itchy, watery eyes. The correct answer is option C. Reduced mucus viscosity. This is correct because guaifenesin is an expectorant that thins and loosens mucus, aiding clearance from the respiratory tract. Option A is incorrect as it does not suppress cough. Option B is incorrect because it does not increase mucus production. And option D is unrelated to its mechanism. Question 49. After an electrical burn injury, the nurse must identify the top priority. The options are A. Obtain an ECG, B. Obtain an ABG, C. Perform wound care, and D. Initiate oxygen. The correct answer is option A. Obtain an ECG. This is correct because electrical injuries can cause fatal arrhythmias, even with minimal external damage. Continuous cardiac monitoring is essential for at least 24 hours post-injury. Option B is useful but not the first priority. Option C is secondary to life-threatening risks, and option D may be indicated but does not address the immediate cardiac threat. Question 50. In this medication calculation scenario, the client is prescribed an intravenous heparin infusion at a rate of 15 units per kilogram per hour, and the client's weight is 70 kilograms. To determine the hourly dose, we multiply 15 by 70, giving 1,050 units per hour. Next, we look at the concentration of the prepared solution, which contains 25,000 units of heparin in 250 milliliters of D5W. This means the concentration is 100 units per milliliter, calculated by dividing 25,000 by 250. To find the infusion rate in milliliters per hour, we divide the required 1,050 units per hour by the concentration of 100 units per milliliter, which equals 10.5 milliliters per hour. On most infusion pumps, we round to the nearest whole number unless otherwise directed, so 10.5 becomes 11 milliliters per hour. This means the correct pump setting is 11 milliliters per hour. As an important safety note, heparin is a high-alert medication, so the nurse must follow facility protocols, verify the calculation with an independent double check, program the pump using the heparin drug library, if available, and monitor the client's laboratory results such as a PTT or anti-exol levels, as well as platelet counts for early detection of heparin-induced thrombocytopenia. A quick sanity check confirms the accuracy. If the solution has 100 units per milliliter and the client needs about 1,000 units per hour, the rate should be close to 10 milliliters per hour, making 11 milliliters per hour a reasonable and safe setting. Question 51. In preoperative lab review, the nurse must determine which result to report to the provider. The options are A. HbA1c 7.2%, B. INR 3.5, C. Hematocrit 42%, and D. BUN 5. The correct answer is option B, INR 3.5. This is correct because the INR is elevated, increasing bleeding risk during surgery, and must be addressed before the procedure. Option A is mildly elevated but does not affect immediate surgical risk. Option C is normal, and option D is low but not dangerous. Question 52. When a client presents to the clinic stating that her home pregnancy test was positive, the nurse must determine how to classify this finding. The options are A. Positive sign of pregnancy, B. Presumptive sign of pregnancy, C. Confirmatory sign of pregnancy, and D. Probable sign of pregnancy. The correct answer is option D, probable sign of pregnancy. This is correct because a urine or serum pregnancy test detects elevated HCG levels, which are considered probable, not positive, signs of pregnancy since other conditions such as ectopic pregnancy, recent miscarriage, or certain tumors can also elevate HCG. Option A is incorrect because positive signs include ultrasound visualization of the fetus, fetal movement felt by the examiner, or auscultation of fetal heart tones. Option B is incorrect because presumptive signs are subjective and reported by the client, such as nausea or frequent urination. Option C is misleading. Confirmatory is not a clinical classification. Confirmation comes from positive signs. Question 53. In discharge teaching for Graves' disease, the nurse must identify which client statement reflects effective understanding. The options are A. I will take my pulse daily and report a rate less than 60 beats per minute. B. I'm going to add hot yoga to my exercise routine. C. I will increase the amount of fiber in my diet. And D. I should tell my physician if my blood pressure's top number exceeds 140. The correct answer is option D. I should tell my physician if my blood pressure's top number exceeds 140. This is correct because Graves' disease, the most common cause of hyperthyroidism, carries a risk for thyroid storm, which involves hypertension, tachycardia, fever, and arrhythmias. Option A is incorrect because tachycardia, not bradycardia, is the concern. Option B is unsafe because heat intolerance is common in Graves' disease. Option C is more relevant to hypothyroidism-related constipation. Question 54. In assessing possible pregnancy, the nurse must categorize the client's symptoms of nausea and urinary frequency. The options are A. Confirmation, B. Probable, C. Positive, and D. Presumptive signs. The correct answer is option D. Presumptive sign of pregnancy. This is correct because these are subjective symptoms that could have causes other than pregnancy. Option A is not a formal sign category. Option B refers to objective findings like a positive pregnancy test, and option C refers to signs directly confirming fetal presence. Question 55. In infection risk assessment, the nurse must identify which client on IV saline is at highest risk for bloodstream infection. The options are A. Midline catheter, B. PICC, C. Implanted port, and D. Non-tunneled central line. The correct answer is option D. Non-tunneled central line in the left internal jugular vein. This is correct because these lines enter through high bacteria areas and have a short insertion tract, making them the most infection-prone. Options A and B carry lower risks, and option C is lowest risk due to subcutaneous placement. Before we move to the next question, I need to talk to you. Yes, you watching right now. I know how much this exam means to you. I know the sleepless nights, the stress, the moments you've doubted yourself. But I also know this. You do not have to go through this alone. Right now, we're offering a massive 70% off on our online NCLEX crash course, the exact program that has helped over 10,000 students pass their NCLEX on the very first attempt. Inside, you'll get live classes where your doubts are solved instantly, recorded sessions you can watch anytime, detailed PDF notes, over 5,000 real NCLEX-style questions, NGN case discussions, and a proven study plan that tells you exactly what to do every single day. I want you to imagine something. The day you see that passing score, the moment you put on that RN or PN badge, the proud smile on your face and on the faces of your family. That moment is closer than you think, but only if you take the right step right now. This is your chance. Don't let fear, hesitation, or procrastination steal your dream. Click the enrollment link in the description, grab your 70% discount, and let's make sure you pass NCLEX in one attempt, together. Question 56 now move to public health teaching. The nurse must identify which activity is secondary prevention. The options are A. STD partner notification, B. HIV prophylaxis, C. Safe food handling education, and D. Cardiac rehab. The correct answer is option A. STD partner notification. This is correct because it involves identifying and treating infections early to prevent spread. Option B and C are primary prevention, and option D is tertiary prevention. Question 57. See the next pulse assessment scenario. The nurse notes an apical rate of 75 beats per minute and radial rate of 69 beats per minute. The options are A. Widened pulse pressure, B. Pulse deficit, C. Pulsus paradoxus, and D. Expected finding. The correct answer is option B. Pulse deficit. This is correct because the difference suggests some heartbeats are not producing palpable peripheral pulses, often due to arrhythmias like atrial fibrillation. Option A refers to BP differences, option C to respiratory-related BP drops, and option D is incorrect because this finding is abnormal. Clinically, further ECG monitoring is indicated. Question 58. When managing workplace conflict, the nurse must choose the most effective long-term strategy. The options are A. Compromising, B. Accommodating, C. Avoiding, and D. A win-win solution. The correct answer is option D. A win-win solution. This is correct because it uses collaboration to meet both parties' needs, building trust and lasting resolution. Options A and B may leave dissatisfaction, and option C may escalate issues if ignored. Question 59. Now looking into cultural competency teaching, the nurse must identify which religion traditionally prefers cremation. The options are A. Hinduism, B. Islam, C. Mormonism, and D. Eastern Orthodox. The correct answer is option A. Hinduism. This is correct because Hindu tradition includes cremation as part of spiritual purification. Islam, Mormonism, and Eastern Orthodox faiths generally prefer burial. Clinically, always confirm with the client or family since practices may vary individually. Question 60. In diabetes medication safety, the nurse must know which sitagliptin side effect is most concerning. The options are A. Nasal stuffiness, B. Abdominal pain, C. Headache, and D. Dry cough. The correct answer is option B. Abdominal pain. This is correct because it may indicate acute pancreatitis, a serious adverse effect. Option A, C, and D are mild side effects. Question 61 move our focus to mass casualty triage. Following an earthquake, the nurse must decide who receives immediate treatment. The options are A, 74-year-old with heavily bleeding wounds, lethargic and pale, B, 37-year-old anxious, tired, using neck muscles to breathe, C, 16-year-old confused, holding head, nauseated, and D, 65-year-old with severe leg pain guarding the limb. The correct answer is option B, 37-year-old anxious, tired, using neck muscles to breathe. This is correct because accessory muscle use signals severe respiratory distress, likely from a traumatic pneumothorax, and can rapidly lead to respiratory failure. Immediate intervention such as decompression can be life-saving. Option A likely represents hypovolemic shock with a poorer immediate prognosis if bleeding is massive. Option C may have a concussion but is not in immediate danger. Option D's injury is painful but not immediately life-threatening. Question 62. In reviewing common causes of negligence lawsuits, the nurse must identify an example of negligence. The options are A. Documenting care under another nurse's login, B. Taking photos of a client's record and sharing online, C. Failing to notify the physician of a critical lab result, and D. Treating a spouse in the acute care unit. The correct answer is option C. Failing to notify the physician of a critical lab result. This is correct because negligence is an unintentional failure to act as a reasonably prudent nurse would, and withholding urgent lab data can directly harm the client. Option A is fraud and a security breach, Option B is a HIPAA violation, and Option D is unethical but not necessarily negligence. Let's switch to question 63. Before starting isotretinoin therapy, the nurse must identify which lab test is essential. The options are A. Lipid panel, B. C-reactive protein, C. Hemoglobin, A1C, and D. INR. The correct answer is option A. Lipid panel. This is correct because isotretinoin can cause hypertriglyceridemia, so baseline and periodic lipid monitoring is critical. Option B is an inflammation marker unrelated to therapy safety. Option C checks long-term glucose control and is not a priority here. And Option D measures coagulation, not routinely needed unless other conditions exist. Clinically, isotretinoin also requires baseline liver function testing, strict contraception due to teratogenicity, and patient education on side effects like dry skin and photosensitivity. See the next question. 64. When teaching about Lispro insulin, the nurse must advise correct timing of administration. The options are A. 30 to 45 minutes before a meal, B. 1 hour after a meal, C. 20 to 30 minutes before a meal, and D. 5 to 15 minutes before a meal. The correct answer is option D, 5 to 15 minutes before a meal. This is correct because Lispro is a rapid-acting insulin with an onset of 10 to 15 minutes, designed to control post-meal glucose spikes. Option A is timing for some intermediate insulins, Option B increases hyperglycemia risk, and Option C applies to regular short-acting insulin. Question 65. In managing infective endocarditis, the nurse must know which medication is anticipated. The options are A. Nitroglycerin, B. Vancomycin, C. Atorvastatin, and D. Aspirin. The correct answer is Option B. Vancomycin. This is correct because infective endocarditis requires immediate IV antibiotic therapy, often starting with empiric broad-spectrum coverage, like vancomycin after obtaining blood cultures, then tailoring antibiotics to sensitivity results. Option A treats angina, Option C lowers cholesterol, and Option D is an antiplatelet drug used in other cardiac conditions, but not primary therapy here. Before we move to the next question, I need to talk to you. Yes, you watching right now. I know how much this exam means to you. I know the sleepless nights, the stress, the moments you've doubted yourself, but I also know this. You do not have to go through this alone. Right now, we're offering a massive 70% off on our online NCLEX crash course, the exact program that has helped over 10,000 students pass their NCLEX on the very first attempt. Inside, you'll get live classes where your doubts are solved instantly, recorded sessions you can watch anytime, detailed PDF notes, over 5,000 real nclex-style questions, NGN case discussions, and a proven study plan that tells you exactly what to do every single day. I want you to imagine something. The day you see that passing score, the moment you put on that RN or PN badge, the proud smile on your face and on the faces of your family. That moment is closer than you think, but only if you take the right step right now. This is your chance. Don't let fear, hesitation, or procrastination steal your dream. Click the enrollment link in the description, grab your 70% discount, and let's make sure you pass NCLEX in one attempt together. Question 66. As we continue with prioritization scenarios, imagine caring for multiple clients at once. It is a priority to follow up on which situation? The options are A. a client with asthma exacerbation who is wheezing while receiving albuterol via nebulizer. B, a client with pulmonary emphysema who puts on their nasal cannula before eating. C, a client with pneumonia ambulating while wearing a surgical mask. And D, a client receiving oxygen via non-rebreather mask with oxygen saturation of 92%. The correct answer is option D, a client receiving oxygen via non-rebreather mask with oxygen saturation of 92%. This is correct because a non-rebreather mask delivers 80 to 95% fraction of inspired oxygen, and if saturation remains only 92%, it means oxygenation is critically low despite maximal supplemental oxygen. This may signal impending respiratory failure, requiring escalation such as intubation and mechanical ventilation. Option A may reflect an expected finding during treatment unless wheezing worsens or stops suddenly. Option B actually reflects a beneficial action for COPD clients during meals. Option C demonstrates safe and appropriate pneumonia care. Question 67. Shifting to pharmacology for neurological disorders, the nurse is caring for a client with narcolepsy. Which medication is most likely prescribed? The options are A, aripiprazole, B, modafinil, C, ropinirole, and D, quetiapine. The correct answer is option B, modafinil. This is correct because modafinil is a wakefulness-promoting agent indicated for narcolepsy and is typically given once or twice daily. Aripiprazole and quetiapine are antipsychotics used for bipolar disorder and schizophrenia, while ropinirole is used in Parkinson's disease and restless leg syndrome. Narcolepsy management combines medication with lifestyle strategies such as scheduled naps and strict sleep hygiene, and modafinil has lower abuse potential compared to older stimulants. Educate patients on possible side effects like headache, anxiety, and insomnia. Question 68. Next, in oral health assessment, the nurse notes reddened gums with bleeding. How should this be documented? The options are A, glossitis, B, caries, C, silosis, and D, gingivitis. The correct answer is option D, gingivitis. This is correct because gingivitis is gum inflammation with bleeding, typically resulting from poor oral hygiene. Glossitis refers to tongue inflammation, often from vitamin B12 deficiency. Caries are tooth decay, and cheilosis refers to fissures of the lips often linked to riboflavin deficiency. Gingivitis can progress to periodontitis if untreated, so hospitalized patients should receive assisted oral care to prevent not only dental issues, but also complications like aspiration pneumonia. Teaching includes brushing twice daily, flossing daily, and holding the toothbrush at a 45-degree angle to the gum line. Question 69. In a post-anesthesia care scenario, a patient reports severe pain 1 hour after analgesic administration, but the next dose is not due for 2 hours. How should the nurse advocate? The options are A, contact the physician regarding the need for more effective pain management. B, assist the patient with non-pharmacological strategies. C, explain that giving medication too soon can be dangerous. And D, provide a quiet environment for rest. The correct answer is option A, contact the physician regarding the need for more effective pain management. This is correct because advocacy involves ensuring the patient's right to adequate pain relief, and this may require a change in prescription or dosage. While non-pharmacologic measures and a quiet environment can help, they do not address inadequate analgesia. Simply explaining dosage timing without problem solving does not fulfill the nurse's duty. Question 70. When reviewing prescriptions for packed red blood cell transfusions, the nurse should question which order. The options are A, client with a febrile illness, B, client with pulmonary edema, C, client receiving mechanical ventilation, and D, client with a chest tube for hemothorax. The correct answer is option B, client with pulmonary edema. This is correct because PRBC transfusions add fluid volume, and in pulmonary edema, this extra fluid can worsen respiratory distress and hypoxia. Such clients are at risk for transfusion-associated circulatory overload, TACO, and require slower transfusion rates and possible diuretics. Fever is not a contraindication, mechanical ventilation does not prevent transfusion, and hemothorax often requires transfusion to replace blood loss. Question 71. Turning to infectious disease in pediatrics, the nurse instructs parents of a child with enterobiasis, or pinworm infection. Which parent statement indicates correct understanding? The options are A, I will ensure my child takes a tub bath every night. B. I will keep my child's fingernails short. C. I will limit how often my child washes their hands. And D. My child should stay home from school during the infection. The correct answer is option B. I will keep my child's fingernails short. This is correct because shorter nails prevent eggs from lodging under the fingernails, reducing reinfection risk. Tub baths can lead to recontamination, frequent hand washing is essential, and school exclusion is not necessary with good hygiene. Pinworm eggs can survive for weeks on surfaces, so wash clothing and bedding in hot water. Treat the entire family if needed and administer an parasitic medication twice, initially and then 2 weeks later. Question 72. In another prioritization case, the nurse is caring for several assigned clients. Which action should be done first? The options are A. Administer acetaminophen for a fever of 101.1 degrees Fahrenheit, 38.4 degrees Celsius. B. Complete pin care for a client with a halo fixation device. C. Administer diazepam for a client with delirium tremens. And D. Insert an indwelling catheter for a client with retention. The correct answer is option C. Administer diazepam for a client with delirium tremens. This is correct because delirium tremens is life-threatening and carries a high risk of seizures, which benzodiazepines help prevent. Fever treatment, pin care, and catheterization are important but less urgent than preventing seizure-related complications. DTs typically develop 48 to 96 hours after alcohol cessation, starting with tremors and agitation, progressing to hallucinations, seizures, and severe autonomic instability. Question 73. Now in the maternity setting, the charge nurse must assign clients. Which client should be assigned to the most experienced nurse? The options are A. A 40-week pregnant client with late decelerations on the fetal monitor. B. A 39-week pregnant client in labor with contractions every 3 minutes. C. A 33-week pregnant client with triplets on bed rest. And D. A 26-week pregnant client with Braxton Hicks contractions. The correct answer is option A. A 40-week pregnant client with late decelerations. This is correct because late decelerations indicate utero-placental insufficiency and fetal hypoxia, requiring immediate expert action. The other clients are stable or experiencing expected findings. Late decelerations require repositioning to the left lateral position, providing oxygen via non-rebreather mask, intravenous IV fluid bolus, and reducing uterine activity if oxytocin is infusing. Question 74. In a neurological assessment scenario, a client has an oculomotor nerve injury. Which finding is most likely? The options are A. Ptosis, B. Anosmia, C. Uvula deviation, and D. Facial asymmetry. The correct answer is option A. Ptosis. This is correct because cranial nerve 3 controls eyelid elevation through the levator palpebrae superioris muscle, and damage causes drooping of the eyelid. It can also cause impaired extraocular movements, a dilated pupil, and loss of the light reflex. Anosmia is linked to cranial nerve 1, uvula deviation to cranial nerve 10, X, and facial asymmetry to cranial nerve 7. 7. A down and out gaze with pupil dilation can signal a compressive aneurysm, which is a neurosurgical emergency. Question 75. Finally, now we close this video lecture session with last scenario of burn management. A client with 18% total body surface area, full thickness burns, arrives in the emergency department. In the first hours after injury, which action is the highest priority? The options are A. Begin intravenous fluid resuscitation. B. Arrange physical therapy consultation. C. Start high-calorie nutrition. And D. Provide outpatient rehabilitation resources. The correct answer is option A. Begin intravenous fluid resuscitation. This is correct because in the emergent phase of burn care, stabilizing airway, breathing, and circulation takes priority, and rapid fluid replacement prevents burn shock. The Parkland formula is used to calculate fluid needs, giving half in the first 8 hours and the rest in the next 16 hours, with a goal urine output of 0.5 to 1 milligram per kilogram per hour in adults. Physical therapy, nutrition, and rehabilitation are important later, but secondary to immediate hemodynamic stabilization. And that's it for practice test 26. Every question you master here takes you one step closer to your NCLEX success. Don't forget, Your 70% off crash course offer is still live, so grab it now from the link in the description. I'll see you in practice test 27. Let's keep pushing forward.